We're going to look at speaking, something called a patient-centered approach as well. And we'll just run through the format of the exam. This is really, we just kind of had a chat about this. It's a consultation role play, and it starts off with a warm-up, which is not assessed. So don't worry, it's just to relax you. And they're going to ask you questions about just about yourself, really, general questions. It's a couple of minutes long, it's not too long. And then it goes on to the actual role play. You're giving your card and you've got 3 minutes preparation time. And this preparation time is really important. Some things you want to do here. And we talked about this earlier. You can ask the interlocutor any questions. Remember, the person who you're talking to isn't an examiner. We call them an interlocutor. They'll be recording your audio. And remember, everything gets sent to Australia and it's marked by examiners there. But you can ask any questions if there's any words you don't understand, if you're not sure how to pronounce any words. All of these, any kind of questions like that, you can ask. Once the role play starts, you can't ask any questions. Okay, so use these 3 minutes wisely, plan your task. Think about what kind of patient you have. Similar to the writing, every task is different. Sometimes a patient could be rather difficult, or they might be quite relaxed and actually okay. Sometimes they're really anxious, so you need a lot of reassurance. So think about the kind of patient you have, because that's going to affect how you do the role play. Think how you're going to start the role play. Remember, you're in charge. You're in control of the role play, and they're going to be waiting for you to start the role play. We'll have a look at some of this a bit later. Also think about your language as well. You might need language of reassurance or of advice. And again, we'll look at this a bit later. After you do the preparation, you then do the role play, and this is 5 minutes. Okay, and once you've done that, you do the whole thing again. So you've got 2 role plays, and in total, everything, it's gonna be about 20 minutes. Okay, is that all good? Hopefully that's all good. And this is what you'll see on test day. You're gonna see something like this. You'll get a card, it tells you who you are. This is a nurse, or if you're a doctor, it will say, you'll get a medicine card. It tells you about the setting, and we talked about this earlier. We were saying how important the setting is. You really need to take note of this because it gives you a really important context. Here you're in a hospital casualty ward, and just think about different settings. It says here, what does the setting tell you about your relationship with the patient? How does it influence how you open the role play? Okay, let's look at a couple of examples. There's a home visit. Let's say the setting is a home visit. Well, when you think about this, you're going to know the patient's name and you'll know their details. You're also going to know the reason for the consultation. So it wouldn't really make sense if you started kind of asking, can I have your name, please? And how can I help you? It doesn't really make sense because you've got the patient's name and you know how you can help them. You know the reason for the consultation. If you think about the surgery and the clinic, if you're in your surgery, you might actually know the patient. It could be one of your patients, but you might not know the reason for the consultation. So you might start with something like, okay, hi Kamala.
Hello.
So how can I help you today? You know, what can I do for you today? Or how are you doing? But you might know the patient's name, so you wouldn't really need to say, okay, so I'm Dr. Baines, and what's your name, please? So again, you can see how the setting really influences how you start the role play. Again, A and E if you're in accident and emergency. You may not know the patient. You may or you may not know the reason why you're meeting the patient, but A&E people generally just come in. Okay, so really think about the setting. Here we've got background information, and this really just provides you with useful information. Read this carefully in those 3 minutes, and get as much information from this as you can. Here it's telling you something, the patient is anxious. It's an important word to pick up on. And Kamala, we were talking about this earlier. What do you think? It's telling you the patient is anxious. So why is that important for you?
I think because he's going for some procedure.
Mm.
And he wants to know what's going to be happen, and he's really like what you call eager. I don't know what we say.
Yeah, you're right, and they're in an anxious state, and so I guess it's kind of telling you as well. You're going to have to reassure this patient. You're going to need a lot of reassurance in this task.
Okay.
Okay, that's really good. And at the bottom of your card, you can see here it says task, and these are the things that you need to do. And you can see all of these start with verbs: find out, reassure, explain, and stress. Stress doesn't mean the medical kind of stress where you're under pressure, but of course, stress here means to emphasize something, to say something is important. So these verbs, these are things that you have to do, but you don't need to finish all of these tasks. You don't get marks. We'll look at the criteria in a short while, but you don't get marks for finishing all of these tasks. But the way these cards are written, you should be somewhere at the bottom of the role play. If you spend 5 minutes and you're still finding out about the patient's concern, something has gone wrong. And that's something you want to do in the 3 minutes. Think about how long will you spend on each task. The first task says, find out about the patient's concern. What do you think, Kamala? How long would you spend on that task?
For task 3 minutes.
Well, only the first task where it says find out about the patient's concerns. Remember, the role play is 5 minutes.
Okay.
How long are you going to spend finding out about the patient's concerns?
Because he's anxious, that means it won't take long. Might be 1 minute.
Yeah, I would say 1 minute maximum. It won't take long at all. You're just going to really be asking them a question about what's worrying them or have you. And if you look at the second task, it says reassure the patient that the possibility of infection is very small, as care is taken to screen donors and test donated blood for possible infection. I think you can see you're going to spend more time on this task. You might spend a minute and a half on this task. And the first task, find out, is very quick. So in those 3 minutes, just try to plan, just kind of think, how long do I need to spend on each task? Okay, after find out, we've got reassure, and then it says explain. And that's really what we're going to be looking at in this lesson, about explaining information, because it's something common, it's something you have to do in almost every role play. Okay, but this is what the interlocutor gets. So the interlocutor also has a card. You can see it tells them that they are the patient. So remember, you're not talking to an interlocutor, you're now talking to a patient. It tells them also the setting. They get background information as well. And they also have tasks to complete as well. Remember, you don't see the interlocutor's card, so you don't see this information. You only have your card. And you can keep your card with you, you can make notes, you can underline things to help you if you need, but you won't see this card. So you can see that the patient also has tasks to do, and it's not you talking for 5 minutes. So this, I'm not sure if you understand this, but this is what you shouldn't do. In this consultation, it's not you talking for 5 minutes. That's really not what they want. Of course, it's a speaking exam and you'll probably be doing most of the speaking, but it's a consultation and they want you to be patient-centered. And this is really what they want. They want you to create a dialogue in those 5 minutes. They want you to have a conversation with the patient. And that's what a consultation is. It's not just a nurse or a doctor talking for 5 minutes, but you're asking questions. you're explaining, you're answering questions from the patient, and that's what they want. Okay, I mentioned something about a patient-centered approach. Just have a quick look at this, because this is really what they want with OET Speaking. And it's really useful if you're looking at working here in the UK, because it's something that we've incorporated really within the healthcare systems. It kind of came into play around the 1970s. But we have a traditional doctor-centered approach, and we have kind of the more modern day patient-centered approach. The traditional doctor-centered approach, doctors are kind of dominant, and also nurses as well, I should really say medical professionals. They were kind of dominant, but with a patient-centered approach, the patient's role is active. So the patient is involved in the consultation. That's what they want. Traditionally, the patient wouldn't really participate. They would just sit and listen to the doctor or to the nurse. But with a patient-centered approach, the patient is involved in the treatment plan. They also give in suggestions as well. Okay. The doctor or the nurse dominates the conversation. With a patient-centered approach, the doctor collaborates with the patient. So the doctor or the nurse, they work together with the patient. The nurse or the doctor, they might give options. They might provide alternative or choices. They will talk about the disadvantages or the advantages. They discuss and weigh up the pros and cons. So the patient is really involved in the consultation. They're not just being told what to do, but they have a discussion. Traditionally, the doctors would do most of the talking. With a patient-centered approach, the doctor talks less and they listen more. And that's important for the speaking exam, because you need to listen to your patient as well. You need to listen and you need to respond to the patient. Traditionally, the focus was on the disease, but with a patient-centered approach, the focus is on the patient. And you take into consideration social factors, physical and economic factors. So you might think about the patient's diet, you might think about their lifestyle, you might think about their work, about their family. And basically you see people as individuals. Two people might have the same symptoms, but you might give them different prescriptions because you look at them as individuals. So patient-centered approach, really you're putting the patient at the center of the consultation. It's all about the patient. It's not about the illness. Okay. If you've got any questions, please, just type them into the chat, or Kamala, please, just interrupt me.
No problem.
Is that okay? Are you okay with that?
Yeah, I'm okay.
Okay. So we're going to read a short consultation, and you need to decide, is the nurse or the doctor, are they patient-centered or doctor-centered? You've got a scale here of 1 to 5. If you think they're doctor-centered, you can give them a 1. If they're patient-centered, give them a 5. If they're somewhere in the middle, you might give them a 3. Okay, let's have a quick read. So we've got Dr. Matthews, and she says, "Good morning, Mr. Jenkins. I'm Dr. Matthews. So I see from the notes you've been suffering from a high temperature. Do you still have a temperature?" He says, "Yes." Dr. Matthews says, "How long have you had that? A couple of days?" Mr. Jenkins, the patient, says, "Oh, no, more than that. I'd say on and off about 2 months." 2 months, okay. Are you shaking? Are you having night sweats? Yeah, I shake and sweat, and yeah, especially at night. Right, okay. Do you have any muscular pain? Yeah, and your joints? You're not suffering from any achy joints as well, are you? Okay, so just a brief consultation there, just kind of the beginning of a consultation. You can see here with all of the questions, what you notice is that actually they're all closed questions. Now, open questions invite more information from the patient. Closed questions are generally specific, and they're kind of yes or no questions. When you're being patient-centered, you want a mixture of both open and closed questions. But this doctor, all the questions here are very specific. They're kind of yes, no questions. So the doctor only used closed questions. Also, if you have a look at these questions here, are you shaking? Are you having night sweat? I'm not sure if you can see what's wrong here. Could you see what's wrong, Camilla?
Are you shaking? Are you having night sweat?
What's wrong? Why shouldn't you really do this in a consultation?
Are you shaking? Are you having night sweat? Like that's like, I don't know, two questions together.
Exactly, you're right. Break up your questions. Ask your questions individually, just one by one.
Yeah.
Really, that's the only problem here. The doctors ask both the questions together. And hair as well. Do you have any muscular pain? And the patient answered, and you can see that actually the doctor interrupted the patient. So as a medical professional, as a nurse or the doctor, don't interrupt your patient. Allow the patient to interrupt you, but it's important you allow them to speak, let them express themselves. So if you had to give the doctor a score here on 1 to 5, what would you do, Kamala? What do you think?
What did you say again? Sorry.
You're going to give the doctor a score at the top here from 1 to 5. What do
Yeah.
you think? How doctor-centered are they? How patient-centered are they? Do you think they're like a 1, 2, 3, or if you think they're patient-centered, you give them a 4 or a 5?
It's actually doctor center, because doctor has spoken more than the patient, I think.
Exactly, yeah. And they've just really used closed questions. They haven't really used yes, no. So I'd give them a 2. It's not all bad. I mean, the doctor was friendly, and she was polite as well. And it was a nice introduction. She introduced herself nicely. But you're right. She interrupted the patient. There were too many closed questions. The patient couldn't express himself. And you're right, the doctor talked more than the patient, in fact. Patient was confused because, there were multiple questions. They were being asked more than one question at the same time. And even the doctor answered for the patient. And this style, it's interrogative, it was questioning, just lots of questions. And really, I think that goes back to too many closed questions. Okay, let's have a look at another example. This is Dr. Smith. Again, you need to decide on a scale of 1 to 5, how doctor-centered are they or how patient-centered are they? Okay, so Dr. Smith says, hello, Sarah, I'm Dr. Smith. How have you been? How have you been feeling? Sarah says, not bad, but I'm still very hot. Can you tell me a bit more about it? And Sarah says, well, I've been having these hot spells for about 2 months. 2 months? 2 months, okay. Any other symptoms? Yeah, I shake and sweat, and especially at night. Right, okay. Do you have any muscular pain? Yeah. Whereabouts? I don't know, all over. Any pain in your joints? Yeah, it flares up every so often, just here. Okay, hopefully you can see the difference between these two role plays. This time the doctor started with open questions. How have you been feeling? Can you tell me more about it? And really inviting the patient to express themselves more. After the open questions, the doctor then moved to closed questions. And this is quite common when you do consultations. You start with open questions and then you move to closed questions. You become more specific. So it's a lot better. The structure of this role play is a lot better. The patient can express themselves more. And I'd give the doctor 4. I think the doctor is a lot more patient-centered here. Really nice style. Didn't interrupt the patient, allowed the patient to express themselves. Started with open and then moved to closed questions. And that's really common in consultations. You often start with open questions and then you move to closed questions. And this is an upside down pyramid. This was devised by one of our OET teachers. This was devised by Beth. And we've got this upside down pyramid. We start with open questions. Can you describe the pain? How long have you had this? And then actually you get more specific. And that's really common. And it's common, you can use that with OET. You know, we teach this on medical English, in fact, but you can use this with OET speaking as well. Just be aware that every role play is different. Just like the writing, every task is different. Sometimes you might need to start with a closed question. Remember, with OET, they like to trick you. They like to keep you guessing. So don't think you can always use this, that you always start with open to closed. Often with consultations, that is what happens, but please just be aware that every task is different. There's a logic here as well. You know, you're starting with symptoms, the onset of symptoms when they started, you're talking about triggers. This is kind of more for medical English. And we have nurses or doctors as well who study with us with medical English. So don't worry too much about that. With OET, really the focus is on starting with open, going to closed questions. And that's really what you want. You want to balance both in the consultation. Okay, just any questions, Kamala? Any questions about that before we move on?
Yeah, like for nurses also we have to ask like this, like from starting with the open and we just need to close question, yeah?
Yeah, exactly the same, yeah.
Okay.
All medical professionals.
Okay. Thank you.
Okay. So this is the criteria. I'm not going to go into detail because this is another lesson on its own, but just to give you a quick overview of this, and so you understand why a patient-centered approach is important. First of all, you can see it's divided into two. You've got the linguistic criteria. This is about things like your speaking. It's a speaking exam, so you need good intonation. It's the pace of your speaking. It's using kind of stressing words. It's the tone of your voice. Using, you know, you should have a good confident voice, but also not intimidating as well, you know, kind of a gentle tone as well, but speaking clearly and, you know, being understood as well. You can also see there's grammar comes into it as well. So using appropriate language, making sure you've got the right tenses as well. So all of that is the linguistic criteria. You'll see on the other side, the communication criteria. So this is really where a patient-centered approach really helps you. You can see things like relationship building. So you need to start a rapport. You need to build a good relationship with the patient. They need to be relaxed with you. It's not good if the patient is kind of scared or intimidated. So you want to be kind of informal and relaxed. If a patient wants to ask you questions, they've got to be comfortable enough to kind of ask you questions. So you should be approachable. So you need to build a nice relationship with the patient. So don't make your language too formal, kind of keep it quite informal and relaxed as well. And also about opening the role play. We talked about that earlier as well. It's important how you start the role play, you know, introduce yourself nicely if you need to do an introduction, but be careful. Sometimes you're in the middle of a consultation and you don't need to do an introduction. And like I said, the setting will kind of give you a clue as to how to start the role play. But it is important how you open the role play because you want to do it in a really nice way. In fact, you want to make sure that the patient knows you're approachable and you want to make sure they're relaxed as well. Okay, that's relationship building. It says here, understanding and incorporating the patient's perspective. So here it's listening to the patient as well. Don't become too focused on your card. Don't become too focused on your task. Remember, you've also got to listen to the patient. If they ask you any questions, you've got to respond to those questions as well. Okay, that's really important. We've got here providing structure. And yeah, we're going to kind of look at this. Structure is important. Information, yeah, sequencing and signposting. We'll come to this later. Information gathering. Okay, we're going to look at this later, but open and closed questions. You need to get information. We've talked a little bit about this. Information giving, and this is what we're going to look at today, explaining information as well. Okay, explaining, clarifying and checking information. That's what we're going to look at. So information giving. So I'm just going to say as well, Kamala, you asked a question and some of you coming in on the chat. This is useful for nurses and doctors as well. So if you are a nurse, don't think this lesson is for doctors. It's not. It's actually for all medical professionals. Speaking is specific to your profession. Doctors get their tasks, nurses get theirs, but you're assessed on the same things. It's the same criteria. So this lesson is useful for nurses as well. If you're a nurse and you're out there, please, don't go away, keep watching, because you're really going to find this useful. In fact, even if you're a physiotherapist, occupational therapist, if you're a veterinarian, whatever your medical profession is, please keep watching, because you'll find this useful. And that's what we're doing. We're looking at the criteria, information giving, and we're going to tie this in with the role play. So let's have a look at an example. This is from a card. Let's see. It says this 45-year-old patient is attending the practice after suffering a mild anterior acute myocardial infarct 2 weeks ago. Recovery was uncomplicated and the patient was discharged from hospital 4 days ago. He or she is now very concerned about the long-term process of recovery. That's the background information. Okay, the task, let's see, this is one of the tasks. You can see here it says explain. Explain the importance of exercise. And they've given you stuff in brackets. You've got to talk about lower cholesterol, losing weight, and strengthening the heart. Now, you don't have to talk about those things. The information they give you in brackets, it's just there to help you. They want you to speak. They don't want you to waste too much time thinking, because they want you to speak. They need your speaking to assess you. So you don't have to use the language they give you in brackets. These are just ideas to kind of help you. But here the task is explain the importance of exercise. Okay, so what's wrong here? Let's look at a sample answer. What's wrong? The nurse says it's important to lower your cholesterol, lose weight, and strengthen your heart. Now, I know you want to go back to work, but okay, what's wrong? Just take a second to think about this. Kamala, what do you think is wrong with this?
She's not going to the topic. She's saying the different thing. Like, it's important to lower your cholesterol, lose your weight, and strengthen. Now I know you want to go back to your work. Like, she's not concerning about his or her medical condition. She's just concerning about his work.
Okay, so you're right. The nurse hasn't really explained the importance of exercise. They haven't actually really done the task. And remember the verb at the beginning here, it says explain, that's what you need to do. They haven't really explained. In fact, they're really just reading from the card. That's all that the nurse has done here. The information wasn't broken up. It was just explained everything in one go. Lower cholesterol, lose weight, strengthen your heart. You could really break up this information, and we'll look at that in a moment. The patient had no opportunity to ask questions. So the patient wasn't involved here. It was really the nurse talking. There was no clarification as well. So the nurse didn't stop to ask whether the patient had understood anything or whether they were okay, whether they could do this. They just moved on to the next task. So in other words, it was very doctor-centered. It wasn't patient-centered at all. When you look at the task, you can see here what I've done is I've broken up this information. It says explain, and remember you can write on your card. So I write numbers, and I know I've got to explain 3 things. I've got to talk about cholesterol, I've got to explain about weight loss, and about the heart as well. So you can break it up, and I've got numbers 1, 2, and 3. It's a great opportunity to use sequences. Sequences are words like firstly, secondly, thirdly, and then after that. They sequence things, they put things in order, and really you get marks if you can kind of use some of these words. Let's have a look at an example. So the doctor or the nurse says, I'd just like to go over a couple of points about exercise, if that's okay. Patient says, okay, that's fine. the doctor or the nurse say as well, it's really important and there are lots of benefits. Firstly, it'll help bring down your cholesterol and that will help keep your arteries clear. Secondly, you'll lose weight by exercising and that will help improve your overall health. And you'll also make your heart stronger, so you'll reduce your chances of having another heart attack. How does that sound? Okay, I hope you can hear the difference between the two consultations. This time, the nurse or the doctor started off, I'd just like to go over a couple of points about exercise. What they're doing here is they're signposting. They're telling the patient in advance what's coming next. And this is a really nice thing to do. Remember in the criteria, it says here providing structure. Providing structure is signposting and sequencing. So signposting, it's kind of things like, okay, we're just going to talk about your diet. So you're telling the patient in advance, we're going to talk about your diet. And that's what's happened here. You're telling the patient in advance, we're going to talk about exercise. So that was really nice. You can see how you can kind of pick up some marks here by using signposting. Also, the nurse or the doctor said, if that's okay. So I haven't just told the patient, this is what we're going to do. I've kind of involved them. I'm being really kind of polite and I'm trying to make it patient-centered. And then again, you can see I've used sequences when I've explained this information. Firstly, secondly, also, all of these words kind of sequences. And again, it's there in the criteria, providing structure, signposting and sequencing as well. So you can see how you can pick up some really useful marks here. And then I talked about cholesterol really clearing your arteries. And I'm explaining that's really what I'm doing. I'm losing weight. You can lose weight. It improves your health. And strengthening your heart reduces your chance of having heart attacks. So I'm doing the task. I'm really explaining. And what you'll notice that I've explained in a very simple way. The language isn't complicated. It's almost the opposite of your writing. In writing, you're writing formal and kind of a professional letter. Now you're keeping your language simple. When you're writing, you're often writing to another medical professional. But now you're speaking to someone who's a non-medical person. It's a patient. So you've got to just keep your language simple, kind of avoid medical terms. Okay. Yeah, and just using some of my own ideas as well, using some synonyms as well. Really, I'm trying not to read from the card and trying not to look at the card and just read the card as well, because it changes your pronunciation as well. When you read, the tone of your voice is different from when you're just speaking naturally. So really just try not to read from the card because it changes your intonation. Okay. At the bottom, how does that sound? Again, I didn't really just tell the patient all this information. I'm trying to make it patient-centered. I'm giving them the opportunity to ask me questions. Okay, so just a nice thing to do as well. When you're giving information, remember you need to clarify, but give them the opportunity to ask you questions. Don't be too quick to go from one task to the next task. Okay, so I've involved the patient, trying to make it patient-centered. Let's look at another example here. It says, you have just examined the patient, an 18-year-old basketball player who has been brought to your surgery today by the team coach because of severe left knee pain. You diagnose a meniscus tear. This is torn cartilage. Now, you've got to be careful here. Remember what I've just said. You're talking to a patient, not a medical professional, and you can see how they kind of tricked you here. Can you see, Kamala, how they kind of tricked you in this task?
Diagnosis of meniscus tear.
Yeah, you've got the right area. What's wrong with that? Remember, you're talking to a patient, not a medical person.
Yeah. He's saying is you have like severe left knee pain, and again the diagnosis. I don't know.
Think about the language as well. Remember, it says here in the criteria, appropriateness of language. So it wouldn't really make sense if I said, okay, you've got a meniscus tear. A patient wouldn't understand that. You can do that in your writing. If you're writing to another nurse or to a doctor, they would understand that. But your speaking is all about the patient. In the same way as your writing is all about the recipient who you're writing to, your speaking is all about the patient. So be careful. If you're going to use these medical terms, be prepared to explain them straight away. And it tells you in brackets as well, it's a torn cartilage. Okay, so kind of be careful if you're better off using layman's terms as well. And that's what they mean, appropriateness of language. Try not to use too many kind of medical terms because you're only going to confuse the patient. Okay, let's keep working here. So we've got the background. Let's look at the task. And you can see there's two tasks with explain. You've got to explain something about medication. Explain why medication is not effective on its own. Also, explain why you are referring the patient to a physiotherapist. You've got information in brackets there. And again, you might want to break this up. There's three things you need to explain. There's something about an exercise plan, a recovery strategy, and a specific treatment as well. So again, I would break this up. I write numbers. I've got it in my head. Okay, I've got to explain three things. And again, I might use sequences here. Let's look at an example here. Okay, so first of all, the doctor or the nurse as well, I should say, don't worry, it says doctor. This is also from a nursing role play as well. It's very similar, in fact. So a nurse or a doctor, they say, so there's no point in taking medication by itself. It isn't that effective, okay? The patient says, well, the doctor says, so I'm going to refer you to a physiotherapist. You can make an exercise plan and this will help you recover by creating a strategy to recover from your injury, and then you can start playing basketball again after you have recovered. But you need to recover first. You will have specific treatments. Patient says, I don't want to see a physio. Can't I just take the medication? Says, no, I've already explained to you that the medication isn't effective on its own, so you need to see the physiotherapist. Patient says, I'd rather not. I'm sure I can recover with some painkillers. And you say, no, you can't. That's just a waste of time. Now, you also need to... Okay, I think you can see that this isn't really a great answer. This isn't really very good, in fact, this answer. Grammatically, it's all okay. It's not too bad, but there's a number of things which are wrong here. First of all, there's no point in taking the medication by itself. It isn't that effective. Well, there's no real explanation. The patient doesn't really want to take medication, and you're not really explaining why they need to take the medication, or why medication on its own isn't really effective. So there's no real explanation. And then the doctor interrupted the patient. Remember, if the patient interrupts you, allow them to interrupt you and listen to them and answer their questions. But here, really, the doctor kind of just went on. They went straight from one task to the next task. And remember to break up your tasks. Pause when you finish a task and allow the patient to ask you questions. Clarify they've understood. But here they went from one task to the next task. They said, I'm going to refer you to a physiotherapist. It's a little bit too direct. You're just telling the patient what you're going to do. And then this explanation, it was quite confusing. It wasn't very clear. And there was just a lot of information in one go. And then there was no clarification. The patient didn't want to see the medication. Sorry, the patient didn't want to see the physio. They just want the medication. But really, there was the doctor or the nurse, they weren't listening to the patient. It's really important you listen to the patient. They weren't being sympathetic and there was no empathy. They're just telling the patient, no, you can't do this. You need to do this. And empathy is something you really need. Not just sympathy, but it really helps if you can put yourself in the position of the patient. Remember, the patient isn't a medical professional. They don't have all your medical knowledge. So try to look at things from their perspective. And it's really important that you are empathetic, not just sympathetic. It's fine to say, okay, I'm sorry, I know that's awful, but really try to understand their situation. Put yourself in their situation and try and look at things from their perspective. And that can really help you because you want to be empathetic and sympathetic. In this task, there was no empathy, there was no sympathy. They were just telling the patient really what to do. So it's quite doctor-centered. Let's look at another example. Okay, so they say, I just want a bit of a chat about treatment, if that's okay. Patient says, okay. Well, the first thing is that the medication will be more effective if you also have some kind of recovery program. Okay, the patient says, what do you mean? Can't I just take the medication? You could, but your recovery would be quicker if you worked with a physio. A physio? I don't have time for that. Well, there are a number of benefits from working with a specialist, which I'll just outline for you if you don't mind. Okay. Well, firstly, you'll be able to make a proper exercise plan, which will help you stay fit without making your injury worse. Another benefit is that you'll be able to have different treatments, like hydrotherapy or pool running, which will help your recovery time. Patient says, I'd really just prefer to take the medication. I do understand, but it really is in your own interest to see a physio. You'll be back on a basketball court a lot sooner. Okay, I hope you can hear the difference between the two consultations. Okay, and you can see really there's some nice stuff here. The doctor, the patient, or the nurse, sorry, the medical professional, they use signposting. I just want a bit of a chat about treatment. You didn't just tell the patient what to do, you're actually telling them in advance what's happening. It's the same when they say, I'll just outline for you some options. It's a nice thing to do. I'm just going to talk to you about something. You're telling the patient in advance what's coming next. So this doctor, this medical professional, they've used signposting. It's really useful. And also look at the language. I just want a bit of a chat about treatment. You can see how informal this is. You don't want to be too formal. Remember, you don't want to intimidate the patient. You want them to relax. So it's like I said, it's almost the opposite of your writing. In your writing, you're trying to be formal and professional. And of course, in your speaking, you're being professional, but you want to keep the language quite informal because you want to build up a nice relationship with the patient. And remember, you don't want to be too much of an authority figure. You kind of want to make sure the patient is comfortable so they can ask you any questions that they like. So it's a nice thing to say. I just want a bit of a chat about treatment. You can see sequences as well. Sequences were used throughout the role play, so you can pick up some marks. This medical professional, they've managed to pick up some marks here. And also the task as well, the exercise plan. You'll notice they talked about the exercise plan, and you'll notice they also talked about specific treatments. They didn't talk about the recovery strategy. They didn't talk about the one in the middle. Like I said, you don't have to say everything that is in brackets. It's just there to help you, but don't feel as though you have to do everything. You have to talk about the exercise plan. You have to talk about the strategy and the treatments because you don't. And you can see in this task, they've only talked about the exercise plan and the specific treatments. And I chose these because I was comfortable with these. I wasn't sure about the recovery strategy, so I kind of just left that. So again, it goes back to using those 3 minutes properly and being selective as well. You can be selective in what you talk about. Remember, it's a speaking exam as well. And a lot of it is about your intonation, your pronunciation, whether you're speaking fluently, the pace of your speech. It's not all about these tasks here. Okay, so remember, you don't have to use all of the information in brackets. Again, there was sympathy here. The patient only wanted the medication. You weren't dismissing the patient and saying, no, you can't, you need to do this. But actually, nice things like this, I do understand. It's, you're trying to be sympathetic. And again, you're trying to encourage the patient as well. It's in your own interest to see a physio. It's a kind of a nice thing to say as well. So you're really trying to be sympathetic and empathetic as well. Okay, I think we're going to do another one. I wonder, Kamala, do you have any questions before we move on?
No, it's okay.
Yeah, okay. You might be taking a lot of information. Feel free to make notes or do take screenshots, or you can watch the video back again as well. Let's keep going. So this is the last one we're going to look at. It says here you're doing a pre-anesthesia evaluation on a 44-year-old patient who will undergo gallbladder surgery. The patient's never had surgery before and is worried about the whole procedure. She's currently medicated for claudication in the legs. Okay, I think you can probably pick up on a word which tells you the patient is a bit anxious and that you're going to have to reassure the patient. Can you see, Kamala, the word tells you, which word tells you you're going to need reassurance?
She's worried?
Yeah, exactly. So you know in those 3 minutes, okay, this patient isn't relaxed, they're a little bit anxious, and I'm going to need some language of reassurance. I'm going to have to reassure this patient. Okay, this is the task, explain. So again, explain the gallbladder removal procedure. It's a laparoscopy, only minor scars where ports are inserted, recovery time is 2 weeks, etc. And you've got to reassure the patient. So in those 3 minutes, remember you're really going to be analysing this role play card you have. You can see how you're going to have to explain something, and you're explaining a procedure. Explicitly, a procedure is quite useful because it's step by step. And every time you get a procedure, you know you can use sequences. So you can use those words, firstly, secondly. And again, breaking up the information, you're going to talk about minor scars where the ports are inserted. That's something, that's one thing. Recovery time is 2 weeks. So there's 2 things. I know I can use sequences here. I've got 2 things to explain. Also, it says here, reassure the patient. So what you've got 2 tasks within 1 task as well. I mean, you're explaining, but also you're reassuring as well. So you need to make sure in your language that you don't stress the patient. You know, your language has got to be language of reassurance. Let's have a look at an example. Okay, so the doctor or the nurse, so this could be a nursing task as well, says, okay, so I'm just going to run through the procedure for the surgery, if that's okay. Patient says, sure, that's fine. And they say, well, it's a laparoscopy. And what that means is we're going to make 2 tiny holes in your side, and then we're going to pass 2 small tubes through these holes. After that, we'll blow a little carbon dioxide into your stomach, and this will inflate it, and it just makes it easier to see what's going on in there. Then the surgeon will be able to remove the gallbladder. How does that sound? The patient says, that sounds awful. Please try not to worry. It's a common procedure which we do all the time, and you won't feel a thing. Patient says, but I might have scarring. It will look horrible. You'll only have minor scars. They'll be barely noticeable. You really don't need to worry about that. Okay, but it doesn't sound very nice. I do understand, but like I said, we do this type of surgery a lot, and the staff here are experienced. You're in good hands. Okay, so hopefully you can see with this is quite patient-centered, and this is how the doctor kind of dealt with this. Again, at the beginning, I'm just going to run through the procedure for the surgery. Nice kind of informal, relaxed language, but you're telling the patient in advance what's going to happen. So again, you're using that signposting, and that's a really nice thing to do. Again, if that's okay, I'm trying to make it patient-centered. I'm trying to involve them. And it's a kind of, it's a nice, polite thing to do. So I've involved the patient. And when you look at the explanation, the key thing is, here I'm doing the task, I'm explaining, but I'm not complicating the language. It's actually very simple. And that's really what you've got to do. Just make sure your explanations are simple. It wasn't complicated at all. I tried to reassure the patient, and I've used some adjectives here. We're going to make 2 tiny holes. I didn't just say 2 holes. When you think about it, if you're being empathetic and put yourself in the position of the patient, they're going to have a laparoscopy. Sure, it's no big deal, but they don't know that. And it's a frightening thing, isn't it, to think that, you're going to have a hole made in the side on the side of your body, and they're going to put a tube into this hole. It sounds like a frightening thing. So I've tried to soften the language. I've said it's 2 tiny holes. And also the tubes, they're 2 small tubes. So I'm kind of softening the explanation here, and I'm trying to reassure the patient, really using these adjectives. After that, we'll blow a little carbon dioxide. Again, kind of, I'm trying to soften it here. It's just a little, it's not a lot, So I'm trying to reassure the patient, really using some of these words. I use the sequences here after that, then. So, again, hopefully I'm going to pick up some marks here. I've got to use the sequences. I've used them accurately. And again, I've made it patient-centered. I haven't just gone on to the next task. I've stopped, and I'm going to let the patient ask me any questions. They can clarify anything if they haven't understood, but I want to make it patient-centered. Pause. How does that sound? Okay. And again, appropriateness of language. You'll notice that all of this was simple. There were no medical words here. And like I said, that's appropriateness of language. You just really want to keep it simple. The patient, of course, was anxious. It told you that on your card. It said the patient is worried. So that's what the patient is doing. They're saying that, well, that sounds awful. They're nervous, they're stressed, and they need more reassurance. And you can see here, try not to worry. It's a common procedure which we do all the time, and you won't feel a thing. A really nice way to kind of reassure the patient. You won't feel a thing. It's a common procedure. So that language of reassurance can really help you as well. And it kind of goes on that the patient asked you a question, and you weren't just looking at your card and thinking about your task and what do I say, but you responded to the patient. It doesn't tell you on your card the patient is going to ask you something. So you just got to keep listening. The patient asks you a question, you've responded. And at the bottom, you're trying to be sympathetic. I do understand, it's kind of a nice thing to say. You're being sympathetic. And again, you're being reassuring. It says here, we do this type of surgery a lot, and the staff here are experienced. You're in good hands. So a lot of reassurance throughout all of this. And some of these phrases, you're in good hands, it's a kind of nice thing to say. You won't feel a thing, Okay. I wonder, Kamala, whether you have any questions about this.
No, I don't know. It's okay.
Yeah, okay. I'll keep going. This is the role play card. This is the whole card. And you see these things a lot, find out and explain. It's very common, and also reassure, find out. So think about open and closed questions as well. When do you need open? When do you need closed questions? And think about your language, your grammar. Make sure you can formulate, you can ask questions in the right tense as well, grammatically correct. You might use a question in the past simple, or you might want to use the present simple. So think about the grammar as well. Open and closed questions. Okay, here's another example. Again, you'll see starts with find out, explain. This is a task, again, one of the tasks we looked at earlier, and reassurance. So these are very common themes in these tasks. Another one here, find out, explain, and reassure, quite common. Just remember, not every task is the same. Not every patient does need reassurance as well. So don't feel as though you need to reassure in every task, but you need to be sympathetic, or you need to be empathetic. That really does help. Empathy goes with being patient-centered, and that's really what they want in OET. Really try to put yourself in the position of the patient. Okay, so with information giving, remember to break up the information. Don't give lots of information in one go. Break it up. And if you can as well, use those sequences and signposting as well. These can really help. Tell the patient in advance what you're going to do, and use those words firstly, secondly, and then, because you can kind of get marks for those as well. So use sequences and signposting where you explain, clarify. Remember, don't be too quick to go from one task to the next. You need to stop, make it patient-centered, give the patient the opportunity to ask you any questions. And keep your language simple. That's really important. Remember, you're not dealing with a medical professional. This isn't a nurse or a doctor. They haven't got your medical knowledge. They don't know medical terms. Just keep it simple. Remember, with a patient-centered approach, involve the patient as well, using open questions. Involve them in the role play. You've got to listen to them. It is a speaking exam, but remember, you've got to listen to the patient. Remember, you're making a dialogue. It's not you talking for 5 minutes. So you're also listening as well. It's a really important part of the speaking exam. And responding to the patient. Remember, you don't know on your card if they're going to ask you questions. You can anticipate sometimes, like when it tells you that your patient is anxious or worried, you might know, okay, they're going to ask you something here. But it's just really important you do respond to their questions. That goes with listening as well. Listen and respond to your patient. Balance open and closed questions as well. Remember the pyramid, often with consultations for both doctors and nurses, you start with open and you kind of move to closed questions as well. And you'll see I've highlighted the word patient here. Patient, patient, patient. Your speaking is all about the patient as well. Okay, keep all of that in mind. I wonder, Kamala, if you've got any questions here you want to ask me.
It's okay, everything all right. I'm just looking everything. It's very nice. Thank you.
It's a lot of information to take in.
Yeah.
But you might want to go back and take notes of some nice language, useful language, and you can do things like take screenshots if it helps as well.
Okay.
Okay, so basically in a nutshell, don't do this. Okay, don't spend 5 minutes just talking to your patient, but do this. This is really what you want to do. You want to make it patient-centered. That's what they're looking for in OET. Remember, it's a speaking exam. Remember your intonation, the tone of your voice. You know, be confident, speak clearly. Don't use very harsh intonation, you know, gentle intonation, especially if you're having to reassure the patient. Speak fluently, you know, don't keep correcting yourself. Try not to get nervous, because as long as you're not too nervous, you know, you'll be fine. And speak clearly, good pace of speech, and, you know, you'll be fine. Okay, so that's what they want, patient-centered approach. Just going to take a quick look at this. These are on our website. Okay, so if you go to our website, wles.net, if you do want some help with speaking, we've got some speaking lessons. There's a really nice speaking course. You have lessons to watch, and then you do 5 role plays with a tutor. And I think, about 5 role plays with a tutor. It's really nice. So you'll actually go onto Zoom or you go onto our online platform. I think each role play, I think it's about 45 minutes. It's really useful. And that can really, the feedback you get can really kind of help you. So have a look at wles.net, have a look at our OET page. You've got speaking courses. This is really nice, OET personalized lessons, not just speaking, but you can focus on reading, on writing, anything you like. We actually will do a consultation with you. We do a 1-hour prep meeting if you like, and then we create a course for you. Depending on what your weakness is. It's really quite a nice thing. You can see there's an offer going on at the moment. So check it out. There's all sorts of other courses. There's writing as well. We've got writing correction service. If you don't want to do the writing course, which is kind of a lot of people, it's really popular at the moment, it seems, our writing course. A lot of people do struggle with writing. But that can help you. But we do writing correction service. That's where we send you case notes, you write your letter, and we correct it. We give you an in-depth kind of correction as well. And that's really popular as well. So if you want help with writing, and there's listening, there's also reading courses as well. And of course, there's packages as well, which are there. And you can have a look at all this information on our website as well. Okay, or if you're interested in OET as well, you know, just come in and have a chat with us. These are our tutors. You can see on the right, there's Catalin, OET. She's an exam interlocutor, in fact, an exam invigilator here in London. Beth in the middle, she's Assistant Director of Studies, done loads with OET. So this is our OET team. If you're here in London as well, you know, pop in, come in and see us. Just come and have a chat with us if you like. Come and have a coffee or a cup of tea with us. We're always happy to talk about OET. Or if you're watching this from somewhere around the world, please do get in touch. Just send us an email. If you want a bit of advice, we're more than happy to give some advice as well. And we're always happy to talk about OET. Okay, so we're going to end it there. And thanks for watching. I know lots of people on Facebook. Thanks for joining us. Kamala, thanks for joining us as well.
Thank you. Thank you.
I'll see you fairly soon as well. And in the meantime, if you've got any questions, you know, just feel free to email me as well.
Okay, thank you.
Okay, guys, nice to see you and take care. And yeah, have a good day.